Yo, what is good? Good morning, everybody. Today we are going to be discussing three bleeding disorders that is usually always on step one, with one of them being a lot more high yield than the other two. But the three that I'm going to talk about is von Willebrand disease, um, also known as vWD, hemophilia A, and hemophilia B. So, big picture is you got to ask yourself, is this a platelet problem or is this a clotting factor problem? Because if it's a platelet problem, then it can cause like mucosal bleeding. Whereas if it's a factor problem, it causes like more deep tissue or joint bleeding. And this is going to help you narrow down the diagnoses. So, just a quick hemostasis overview. Primary hemostasis, it involves like platelets forming a platelet plug, and then secondary hemostasis, it involves clotting factors forming fibrin. And as you might already know, von Willebrand disease, it affects platelets, whereas hemophilia affects clotting factors. So, and then just lab basics, PT tests extrinsic pathway, PTT tests intrinsic pathway, and bleeding time test platelets. So if the bleeding time is prolonged, then obviously you know that's like a platelet problem. Whereas if the PT is prolonged, then you know it's like an extrinsic factor pathway, extrinsic pathway problem. So let's start with von Willebrand disease. Oh, I know there's a lot of information, but it's not too bad. So I just want to start off by saying that this disease is autosomal dominant, and von Willebrand factor, it usually bridges glycoprotein IB on platelets to vascular endothelium or the underlying collagen. So it does platelet adhesion, not aggregation, but adhesion. And you will see that it is the most common inherited bleeding disorder, whereas and it also and then you'll see that the Willebrand factor will be decreased, obviously, and therefore you cannot and therefore platelets cannot bind to collagen properly. So you usually get nosebleeds, heavy periods, easy bruising, mucosal bleeding, and you will have an increase in bleeding time, because the platelets aren't functioning properly, and then you also have an increased PTT, only slightly, just because you have the decreased factor 8. PT is not affected, and platelet count is not affected. So if you get like a question where you have like a 18-year-old girl who gets a lot of nosebleeds, or gets a lot of nosebleeds and has like heavy periods, or you get the same girl, but she has like a history of bruising, and she has like excessive bleeding with tooth extraction. It's kind of like pointing to von Willebrand disease. You should also note that the ristocetin cofactor assay is also abnormal. And the treatment, you use desmopressin, which can help boost functional von Willebrand disease levels. So that's just something to keep in mind. So you will see, like, because von Willebrand disease affects both platelets and clotting factors, you'll just see both of them in this disease. So next is hemophilia A, in which it is a X-linked recessive. You'll have isolated increase in PTT, and bleeding time and platelets are normal, and the reason is because it does not affect platelets, right? So that's kind of why it only affects the pathways. or clotting factor, sorry. But it will present usually like as like a young kid who has like hemarthrosis with an isolated increase in PTT. That's like a really huge giveaway. Or they'll have like a family history, like they'll say like a maternal uncle died a couple of years ago because of some type of trauma or something. And hemophilia A is treated with DDAVP, or if it has like factor 8 replacement. So yeah, just remember, like, so if you have factor A and then you give someone who has like factor B, usually their factor B's blood will like kind of cure factor A, right? And you'll have like, so hemarthrosis, the D muscle bleeds, and the post-surgical bleeding is like is heavily seen. I think the hemarthrosis definitely is the most high yield though. And then factor B, hemophilia B is pretty much the same, except it's factor 9 versus 8. So that's just like that's like the big difference in the two disorders. And here is the sample question. I'll give you 5 seconds. 5, 4, 3, 2, 1. Which of the following is the most likely diagnosis? A 30-year-old woman presents to the clinic with persistent oozing from her gums 8 hours after a routine dental extraction. She reports frequent nosebleeds since childhood and notes that she bruises easily after minor trauma. She takes no anticoagulant medications and has no history of liver disease. Lab studies show platelet count is normal, morph normal, aggregation normal, aggregation decreasing with resistance. Okay, bleeding time prolonged, and factor 8 activity decrease. Okay, which of the following is the most likely diagnosis? Okay, so how should you tackle this question? First thing you should do, obviously look at the lab studies, right? This is the last objective finding, and we can see that, okay, factor 8 activity is decreased. Okay, so what does that mean? Okay, it's not C, it's not D, it's not A. It says no history of liver disease, so it's not A. And we also see that it's decreased with ristocin. Oh, well, we literally just discussed that that's von Willebrand's disease, right? So there you go. You don't even have to go back up. It's literally right there. And you will definitely get questions like this. It's not like, but it's like if you don't know this, obviously you have to keep going up. But since you know this, then you know that they're talking about von Willebrand disease, right? So there you go. Other clues that it is E is that she has mucosal bleeding and easy bruising. She also has prolonged bleeding after dental work. So you have platelet dysfunction, right? And that's just not hemophilia A or B. So this is just like a summary slide. Just remember the inheritance, I feel like, and maybe the PTTs, and then the increasing bleeding time. But yeah, sorry, it's a quick video. Hope you guys enjoy the rest of your day. Life lesson for the day, as simple as it might be, I'm gonna leave it quick. Just make sure you drink like a lot of water. All right, deuces, bye.